Thank you. Good morning, good afternoon.
Good morning.
Actually, it's a great pleasure to be here because in the last years I was very aware about the evolution of the work of the candidate. First of all, I want to congratulate the candidate and the supervisor for the diligent work and the dense information. Actually, I didn't understand Dutch, but I read the document. Then certainly the topic is part of the challenges of the 21st century, and as any novel innovation, there is reluctance to adopt and to enroll. And I do think that here we have a lot to do, and the work done by Hans is in this lane, and it's pioneering a lot of aspects related to e-health and to the society in general. Should I ask the question now? Or?
Yes, please.
Yes. Well, as everything which is new, you know, the society is reluctant to adopt and to enroll. And I have two-part questions for the candidate. One is, what is concretely needed in the current curriculum of the medical school, nurses, managers, administrators, to have the practitioners more open to the e-health systems? This is the first part. And the second, related somehow, is what is the incentive of the health institution to adopt e-health in terms of sharing the part of savings? Because the governments are pushing this kind of activities. However, there is nothing, or almost, as we talk, coming back to those spending some effort, sometimes in personal, sometimes in money. So since I think the work is in preparing the experts to drive this kind of solutions, I will be very happy the candidate shares with us what is his opinion in what the next steps should be, the society should go to.
Highly learned opponent, thank you for your question. It is a very relevant question, the question of education. Here at the university we're all aware of the importance of education. And actually we are in need of high quality e-health professionals in the short term. When we look at the landscape of e-health education in the Netherlands, we see a very fragmented landscape. There are no introductory texts, there are no handbooks. There is the terminology, there's no unity in language, so to say. We speak of medical informatics, e-health, clinical informatics, ICT and care, and well, higher education as well as universities. They offer a lot of courses. They're also offered commercially. So about your first question, what is needed in the curriculum is actually unity, I would say. Unity and collaboration, and the production of the generation of, well, handbooks, introductory texts. The Dutch Association for e-health, NVEH, on its site, I think they did it together with Sintens and also University of Twente. They produce an overview of what is there in education, and you can really see the fragmented nature if you would look at that. So, unity in programming, in language, in collaboration, that would be really my answer. Of course, the nature of e-health is multidisciplinary. It is on the crossroads of health, of technology, of social sciences. So, by nature, there are different definitions and languages and paradigms. But okay, unity is necessary. I hope this satisfies your first question. Yeah. Your second question, I don't have too much time, Professor.
I think it's a good point. It's a very good point.
The second question is about the what would be needed for healthcare institutions to adopt e-health. Yeah, well, a very relevant question, not only in the Netherlands, also in other countries. We know already a lot about the barriers for uptake and impact of e-health technology. Basically, a recent KNMG report a few months ago, they identified that money was a big barrier, the attitude of healthcare professionals, and if I remember well, poor change management. So these three barriers we have identified already. In many countries it's about the same. There may be some more, some less, but basically that's it. So one thing is, how do we get rid of these barriers? Well, there are also drivers for e-health technology. One driver would be the promise of more efficiency. And of course there has to be evidence for more efficiency. Evidence in the eye of a researcher is something else than evidence in the eye of a patient. So maybe best practices will do, but we need also these drivers, efficiency, the promise of efficiency I would say, and also in this report mention was made of the expectation of consumers. Consumers, we, patients, we can be a patient any moment, we expect that healthcare institutions offer e-health in many forms. So getting rid of these barriers that we have already identified and promoting these drivers, I think that would be basically my answer to your second question.
Yes.
Of course, how to do that is how you would design a strategy to actually achieve those objectives. We need to speak a little longer about it.
Yes. Yes, and also it's question of practice, seeing the step by step what the positive and cons and pros are or different actions. Well, with this, I think I have to congratulate again. I am very aware about the work done, and I'm very comfortable with the report. I wish the candidate good luck, and of course, I leave you talking in Dutch. That is not yet an international language.
Well, thank you very much, Professor Dini, for your contribution. Okay, yes, and so, as you already announced, we will now change to Dutch.